And the next is the larynx and the important pathological condition, including the acute epiglottitis. And acute epiglottitis is actually the acute inflammation of the epiglottitis. As we know that the Haemophilus influenzae type B is the most common cause, especially in the unvaccinated children. The clinical feature in this case is the high-grade fever, sore throat, drooling, and the patient present with a dysphagia, muffled voice, and the inspiratory stridor. Risk of airway obstruction in this case. The gross morphology is the swollen cherry-red epiglottitis, so this point is high heat. And the macroscopic morphology in this case is the acute inflammatory infiltrates with edema and the neutrophils. Medical emergency, this can be the medical emergency due to the sudden airway compromises, and hepatitis B vaccination has reduced incidence significantly. The next one is the laryngotracheobronchitis or the CROP. It is a viral inflammation of the larynx, trachea, and the bronchi. As indicated from the name, the laryngotracheobronchitis means it actually involves the upper respiratory tract, including the larynx, the trachea, and the bronchitis. The etiology is the para-influenza virus, which is the most common cause in this pathology. The clinical feature of the patient in this case, the hoarseness, barking cough. So the barking cough is super high yield in this topic. Inspiratory stridor, and the gross morphology in this case, the edematous upper airway mucosa, and the macroscopic morphology is a mucosal inflammation with the mononuclear inflammatory cells. Usually affects young children. Symptoms are often worse at the night. The next is the vocal cord nodule, which is also known as the singer's nodule, benign nodule arising on the true vocal cords, and it is just because of the excessive voice use, usually bilateral. The histology is that it is composed of the degenerative myxoid connective tissue. Clinical feature in this case, the hoarseness or the voice fatigue, and then the gross morphology is the small bilateral nodules on the vocal cords, and there is the myxoid degeneration beneath the squamous mucosa. This is common in the singers, teachers, and the